Hello, and welcome to this lecture discussing general sensory receptors. My name is Laura McLeod, and I'm an instructor here at Ultimate Medical Academy. In this lecture, we'll be going over the 5 special senses and diving deep into a discussion of the eye and sight. Sensory receptors are structures that are stimulated by changes in the environment. Sensory receptors for touch, pain, temperature, and pressure are found all over the body in the skin, connective tissue, and muscle. There are special sensory receptors, which include the taste buds of the tongue, cells in the nose, the retina of the eye, and the special cells in the inner ear. When a sense organ is stimulated, the impulse travels along nerve pathways to the brain, where the sensation is registered in a certain area. Sensation actually takes place in the brain, but is mentally referred back to the sense organ. This is called projection of the sensation. The sensory receptors become less sensitive with age. A decrease in the number of receptors makes it more difficult for older adults to feel pain or cope with changes in temperature. The special senses are those organs and receptors that are associated with touch, vision, hearing, smell, and taste. These specific receptors are located in the taste buds of the tongue, in the nose, in the retina of the eye, and in the inner ear. Sight, hearing, and smell are distant senses. They bring information from far away. Touch and taste can only reveal information about things with which you actually come in direct contact with. Functions of the special senses are to receive stimuli from the sensory receptors, the eye or sight, the ear for hearing, the nose, smell, and the tongue for taste, and to transmit these impulses to the brain for interpretation. The human eye is a tender sphere about 1 inch in diameter. It is protected by the orbital socket of the skull, the eyebrows, eyelids, and eyelashes. When we blink, the eyes are continuously bathed in fluid by tears secreted from the lacrimal glands, which are located on the underside of the upper lid of each eye. Tears flow across and downward to the lacrimal canal, which consists of a duct at the inner corner of each eye. Ducts collect the tears and empty them into the nasal lacrimal duct that drains the excess tears into the nose. Have you ever wondered why, when you cry, sometimes your nose starts to drain? This is why. Lacrimal secretions contain lysozymes, which help combat bacterial infections. Tears actually cleanse and moisten the eyes on a continuous basis. Along the border of each eyelid are glands that secrete an oily substance that lubricates the eye. The canthus is the angle where the upper and lower eyelids meet. The conjunctiva is the thin membrane that lines the eyelids and covers part of the eye. The conjunctiva secretes mucus that helps lubricate the eye. The location of the eyes in front of the head allows for superimposition of images from each eye. This enables us to see stereoscopically in these dimensions: length, width, and depth. The wall of the eye is made up of 3 concentric layers, or coats, each with its specific function. These 3 layers are the sclera, choroid, and retina. The sclera, or white of the eye, is a tough, unyielding fibrous capsule that maintains the shape of the eye and protects the delicate structure within. Muscles that are responsible for moving the eye within the orbital socket are attached to the outside of the sclera. These muscles are referred to as the extrinsic muscles. They include the superior, inferior, lateral, and medial rectus, and the superior and inferior oblique. The choroid coat, or middle layer of the eye, contains blood vessels to nourish the eye, and a non-reflective pigment rendering it dark and opaque. The pigment provides the choroid coat with a deep red-purple color. This darkens the eye chamber, preventing light reflection within the eye. In front, the choroid coat has a circular opening called the pupil. Light passes into the eye through the pupil. A colored muscular layer surrounds the pupil. This is the iris, or colored part of the eye. The iris may be blue, green, gray, brown, or black. Everyone has always wondered, how do you get your eye color? Well, eye color is actually related to the number and size of melanin pigment cells in the iris. If there's little melanin, the eye is blue because light is scattered to a greater extent. With an increase in quantities of melanin, your eye color ranges from green to black. The total absence of melanin results in what's a pink eye color. Such irises are pink because the blood inside the choroid blood vessels show through the iris. Within the iris are two sets of antagonistic smooth muscles, the sphincter pupillae and the dilator pupillae. Those intrinsic muscles help the iris control amounts of light entering the pupil. When the eye is focused on a close object or stimulated by bright light, the sphincter pupillae muscle contracts, making the pupil smaller. On the opposite end, when the eye is focused on an object in the distance or stimulated by low light, the dilator pupillae muscle contracts. This causes the pupil to actually grow larger, allowing as much light in as possible. The retina of the eye is the innermost or third coat of the eye. It is located between the posterior chamber and the choroid coat. The retina does not extend around to the front portion of the eye. It is on this light-sensitive layer that light rays form an object from an image. After the image is focused on the retina, it travels via the optic nerve to the visual part of the cerebral cortex, or occipital lobe. If light rays do not focus correctly on the retina, the image is not sharp. This condition may be corrected with properly fitted contact lenses or eyeglasses, which bend the light rays as required. The retina contains pigment and specialized cells known as rods and cones, which are sensitive to light. The rod cells are sensitive to dim light, and the cones are sensitive to bright light. The cones are also responsible for color vision. There are 3 varieties of cone cells. Each type is sensitive to a special color. The part of the retina where the nerve fibers enter the optic nerve to go to the brain is called the optic disc. Viewing the retina through a scope, you can observe a yellow disc called the macula lutea. Within this disc is the fovea centralis, which contains the cones for color vision. The area around this is the extrafoveal or peripheral region. This is where the rods or dim and peripheral visions can be found. Slightly to the side lies a pale disc called the optic disc, or the blind spot. Nerve fibers from the retina gather here to form the nerve. The optic disc contains no rods or cones. Therefore, it's unable to convert images into nerve impulses. The lens is a crystalline structure located behind the iris and pupil. This means it is a unique arrangement of atoms that are set in a particular way. The purpose of the lens is to focus images on the retina. It has concentric or circular layers of fibers and crystal clear proteins in solution. It is an elastic disc-shaped structure with front and back curved surfaces that form a biconvex lens. This means it resembles something like a lentil where it curves or bulges outward. However, the back surface is more curved than that of the front. The curvature of each surface alters with age. The capsule surrounding the lens loses its elasticity over time. This is why a lot of people tend to need glasses later in life. The lens is held in place behind the pupil by suspensory ligaments from the ciliary body. The ciliary body consists of smooth muscle. The muscle controls the shape of the lens for vision at near and far distances. This is the process of accommodation. The lens is situated between the anterior chamber and the posterior chamber. The anterior chamber is filled with a watery fluid called aqueous humor. It is constantly replenished by blood vessels behind the iris. Aqueous humor fluid, or clear fluid, is constantly filtered and drained through the trabecular network and canal of Schlemm. Vitreous humor, a transparent, jelly-like substance, fills the posterior chamber. Both of these substances help maintain the eyeball's spherical shape. Intraocular pressure is a measurement of the fluid pressure inside the eye. This pressure is regulated by the rate at which aqueous humor enters and leaves the eye. The pathway of our vision is intricate, and much like the rest of our body, all pieces need to work together to accomplish the end goal. If you start with the images in the light, it passes through the cornea to the pupil, through the lens, where the light rays are bent or refracted, then to the retina. The rods and cones pick up the stimulus, goes to the optic nerve, the optic chiasma, where the two optic nerves cross, then to the optic tracts, and then finally the occipital lobe of the brain for interpretation. With our eyes, we can have eye disorders. First, conjunctivitis is an inflammation of the conjunctival membranes. There's redness, pain, swelling, and discharge of mucus. Conjunctivitis, or pink eye, usually begins in one eye and spreads rapidly to the other by a washcloth or hands. Glaucoma is a condition of excessive intraocular pressure resulting in the destruction of the retina and atrophy of the optic nerve. The condition results from overproduction of aqueous humor, or the obstruction of its outflow through the canal of Schlemm for absorption into the venous circulation. A cataract is a condition in which the lens of the eye gradually becomes cloudy. This frequently occurs in people over 70 years of age. The condition causes a painless, gradual blurring and loss of vision. The pupil appears to change color from black to milky white. Macular degeneration is another eye disorder that occurs as a person ages. In the central part of the retina is the macula, which is responsible for sharp central vision. Symptoms include a dimming or distortion of vision that is most obvious when reading. In one form of the disease, straight lines look wavy, and blind spots may develop in the visual field. The two types of macular degeneration are dry and wet. In the dry type, the main defect is a gradual thinning of the retina. This is slowly progressive and there is no known treatment. Central vision will be greatly reduced, but usually there is not total blindness. In wet macular degeneration, new blood vessels grow behind the macula, leaking, bleeding, and distorting its shape. Detached retina is another problem that can occur with aging. It can also occur as a result of a traumatic accident at a younger age. The vitreous fluid contracts as it ages and pulls on the retina, causing a tear. Diabetic retinopathy is the leading cause of blindness in American adults. It is caused by changes in the blood vessels in the retina. Blood vessels may swell and leak, or abnormal blood vessels may grow on the retina. A stye is a tiny abscess at the base of an eyelash caused by inflammation of a tiny sebaceous gland of the eyelid. The eye is red, painful, and swollen. Most of the time in a simple eye irritation, the natural flow of tears will help cleanse the eye. Eye irritations can be caused by chemicals or fragments that get into the eye. If this happens, rinse the eyes with water for at least 15 minutes and seek medical treatment. In situations where a piece of glass or other fragment gets in the eye, do not attempt to remove the object. Put some patches on them and get some medical treatment. A corneal abrasion and scarring may occur as a result of an accident or irritation. The cornea is avascular. That means it does not have any blood vessels. Therefore, when a corneal transplant is performed because of scarring, tissue rejection is not an issue because there are no blood vessels present. Eye strain is experienced as burning, tightness, sharp or dull pain, watery, blurry vision, and headaches. If a person has any discomfort when viewing something, it can be called eye strain. The most common cause today is too much use of computer or just any sort of screen. Too much light may be coming from behind the computer or the screen, and this strong light behind the user may be causing a glare on the computer monitor. These problems can be resolved by repositioning the monitor, using a glare screen, using glasses that prevent the extra light, or wearing dark clothing to reduce glare caused by reflection. Another cause of eye strain is dry eyes, which can result from staring at a book or computer screen and forgetting to blink. To relieve this, the computer monitor should be positioned just below eye level so that the eyes are not open too widely. If glasses are necessary, the user should wear glasses that allow for near, intermediate, and far vision. Sometimes with your eyes, you can have vision defects. Night blindness is a condition that makes it difficult to see at night. The rod cells in the retina are affected in this condition. Color blindness is the inability to distinguish colors. The retina has 3 specific types of cone cells that are related to the primary colors: blue, red, and green. The cone cells are affected in color blindness. Presbyopia is a condition in which the lens loosen their elasticity, resulting in a decrease in ability to focus on close objects. Hyperopia, which is farsightedness, is a condition in which the focal point is beyond the retina, because the eyeball is shorter than normal. Objects must be moved farther away from the eye to be seen clearly. Myopia, or nearsightedness, is a condition in which the focal point is in front of the retina because the eyeball is elongated. Objects must be brought close to the eye to be seen clearly. Amblyopia is a reduction or dimness of vision. Astigmatism is a condition in which there is an irregular curvature of the cornea or lens, which causes blurred vision and possible eye strain. Diplopia is also known as double vision. It is the perception of 2 images in a single object. Strabismus is a condition in which the muscles of the eyeball do not coordinate their action. This can be causing crossed eyes. Of course, there are different types of eye surgeries. First, cataract surgery. Phacoemulsification is a preferred technique for cataract extraction through a small incision. An ultrasound or laser probe is used to break the lens apart without harming the lens capsule. These fragments are then aspirated out of the eye. A foldable intraocular lens is then introduced through a 3 mm incision. Once inside the eye, the lens unfolds to take the position inside the capsule. No sutures are needed because the incision is self-sealing. Visual rehabilitation is extremely fast. And 2 weeks after surgery, the patient will be able to perform any activity without risk. Extracapsular extraction is an older technique in which a 12 mm incision is made in the eye to extract the lens as a whole. This method is used when the cataract is in a very advanced stage. The lens capsule is left in place to hold an intraocular lens. Multiple sutures are required to seal the eye after surgery. These sutures must be carefully tightened so as to not produce astigmatism. Most retinal tears need to be treated with laser surgery or cryotherapy, which seals the retina back to the back of the eye. Pneumatic retinopaxy, a gas bubble, is injected into the vitreous space inside the eye. The gas bubble pushes the retinal tear close against the back of the wall of the eye, where it can be reattached. The head must be held in a certain position for several days. The gas bubble will gradually deflate and disappear, and the retina will reattach. Virectomy is the vitreous humor is removed from the eye and usually replaced with a gas bubble. The body's own fluid will gradually replace the gas bubble. The scleral buckle. This treatment involves placing a flexible band around the eyeball. This band compresses the eye inward, reducing the pulling of the retina and thereby allowing the retina to reattach to the interior wall of the eye. Finally, LASIK. LASIK is a refractive surgery, a special surgical procedure that permanently changes the shape of the cornea. A special knife is used to cut a flap in the cornea. A hinge is left at one end of this flap. The flap is folded back, revealing the middle section of the cornea. Pulses from a computer-controlled laser vaporize a portion of the cornea and the flap is replaced. After the procedure, the cornea should be able to bend or refract light rays to focus more precisely on the retina rather than at some point beyond or short of the retina. LASIK eye surgery is an option for patients who have myopia, hyperopia, and astigmatism. Most eye physicians still recommend using glasses and contact lenses as the first option to treat these conditions. LASIK surgery for presbyopia is not recommended because the surgery may give the person clear distance vision, but it might make it even more difficult to see objects close up. With LASIK surgery, vision will not necessarily be better immediately, but over the following 2 or 3 months, patients should have 20/25 or better vision. PRK, or photorefractive keratectomy, the surgeon removes the very top layer of cells of the cornea, often by scraping them away after loosening them from alcohol. Then uses a laser directly on the exposed surface of the cornea. With PRK, the eyes generally take several days to heal. Then vision is blurry for a week, and then it clears. Dry eye problems are the #1 complication after laser eye surgery and may be helped with special eye drops. With everything on our body, the effects of age can have a significant change. Tear production and quality decrease with age, causing dry eyes. Dry eyes make your eyes feel hot and gritty and appear irritated, but seldom cause eye damage. Artificial tears are helpful with this condition. The loss of elasticity, opacity of the lens, and atrophy of the ciliary muscle decrease a person's ability to focus on fine details. This change compromises the accommodation of lenses. Older adults need more time for the eyes to adjust from light to dark. Thus, they have a loss of night vision. With age, the fluid in the eyes becomes cloudy, reducing light sensitivity. The cornea becomes thick and less transparent. The thickened cornea scatters light inside the retina, making glare more of a problem. The changes in the eye also affect color perception, making it more difficult to distinguish between blues, greens, and violet. Peripheral vision and depth perception decline with age. An adequate visual field is necessary for driving and walking in crowded places. The depth perception loss leads to falls and mobility problems because of miscalculations about the distance and height of objects. Loss of visual acuity occurs from changes in the lenses. Cataract formation, glaucoma, and macular degeneration occur most often as one ages. I want to thank you for attending this lecture. If you have any further questions related to this topic, please don't hesitate to reach out to your instructor.